Okay, hello guys. This day I want to be talking about the types of diabetes. I want to break them down for us to understand the types of diabetes. What are the types of diabetes? In my former video, I talked about the type 1 being commonly seen in children where the body has problem producing insulin, and then in the type 2 commonly seen in adults where the body produces insulin but has problem with using it. And there's another type of diabetes that we also call the gestational diabetes. This gestational diabetes is seen in pregnancy. Sometimes pregnant women have high sugar level, okay, and they have diabetes in pregnancy, and which affects both the mother and it also affects the baby. So that is the importance of antenatal care. If you're pregnant, you should register for antenatal where you have trained nurses and doctors so that they can check and monitor everything that needs to be monitored in that pregnancy. It's not just to check if the baby is lying well or sitting well and all that. There is also need to monitor the mother so that some of these things don't affect the baby at the end of the day. So let's look at type 1 diabetes. Type 1 diabetes, like I said, is commonly seen in children. And here the body has problem with producing insulin. So the pancreas, which is the organ in the body that produces insulin, is not functioning properly. It's not producing insulin well for the body to use. So that is why you see in type 1 diabetes in children what we called early onset diabetes or childhood diabetes or juvenile diabetes. This is what the terminologies have been used to explain or illustrate what happens and the onset of this illness in the past. These children are placed on insulin. They are placed on insulin. They inject insulin into the system so that the insulin from outside that they are injecting is now what does the work, because the body's insulin is not coming. The body is not producing insulin. Now, in the type 2 diabetes, commonly seen in adults, this is where the body produces the insulin, but there's problem with using it. The body is not using it well. The body is not utilizing it well. So in type 2 diabetes, the problem is with the utilization, not with the production. Okay, it's with the utilization. So you see, these adults are given drugs to manage their diabetes. And oftentimes, basically, what these drugs do is that they go to pushing this glucose, now this sugar, into the tissues that utilize them, because the problem is with the body responding to insulin. So there is insulin already, but the body is not using it well. Now, in gestational diabetes, this is a situation where the pregnant woman has a high blood sugar in the diabetic range. Okay? And in this case now, the mother's blood sugar is high and it passes to the baby. This high blood sugar level passes to the baby, and you see these babies becoming very big. We call them macrosomic babies. They become very big, and if they are not well handled immediately after delivery, there can be problems that can even lead to the death of that baby. So in as much as we like big babies, yeah, this baby is big, I like the big baby, but sometimes it can be as a result of illness in the mother. It can be as a result of the diabetes in the mother that the child has come down to be that big. You understand? So I'm not saying every big baby is born from a diabetic mother, no. But I'm saying that oftentimes these women have big babies. You understand? So in the next video, I don't want these videos to be long because I want to ensure we watch them. In the next video, I'll be talking about what are the signs and symptoms and possibly what are the complications of diabetes. So stay tuned, go nowhere, drop those questions, share these videos. I want to hear from you. I want to see these videos flying all over the place. I want to ensure that we are learning. I'm not just learning, we are practicing what we are learning. Okay, talk to you some other time. Bye.